Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today the topic of our presentation is basically the cataract formation. Now, cataract can basically be defined as the cloudiness of the lens that can be due to different causes. There is basically a range of classification that is related to the cataract formation. It can be traumatic, it can be the inflammatory causes, it can be congenital cataract, and it can also be due to the autoimmune disorders. So these are the different sorts of cataract that we usually see in our OPDs or in our clinics. So we'll be discussing that over here. What is the typical kind of history that is given by the patients? Usually in terms of the signs and symptomatologies that they're experiencing. That is again very important. Why is it important to study this cataract formation? If left untreated, this cataract can even cause the vision loss and sometimes total or complete blindness in an individual. Usually it occurs unilaterally, but it can occur bilaterally, and sometimes the progression in both of the eyes is quite different. So this is what we're going to discuss over here. In the very first section, we're just going to refer to the lens anatomy. So what are the different anatomical structures and what are the different parts of the lens that basically constitute the morphological classification of the cataract. It can either be a nuclear cataract, a cortical cataract, a subcapsular cataract, and this subcapsular cataract can be either anterior or either posterior. So these are the different morphological classifications, and they can only be known if you have a grip and you have a knowledge regarding the lens anatomy. So that is what we'll be discussing in the very first section, and then we'll be moving on to the structure of the lens. It's again very important to know the different components of the lens, the different layers of the lens that are present. So we would know the different pathophysiological basis of the cataract formation. The epithelium of the lens, how is it affected? By obviously different types of instincts are there for the epithelium of the lens that can be affected, and that basically going to result into the opacity of the lens. In the very second section, we'll be discussing what is cataract. So basically, how do you define this condition is again very important. So we'll be discussing the opacification of the lens over here, and behind this opacification, what are the causative factors for the development of this opacification? That is what we'll be discussing over here, how prevalent this condition is. This is basically quite a prevalent condition. Again, it's reported quite commonly, mostly usually in the 8th or in the 7th decade of life, people present with this condition. It can be an age-related condition, so usually people present in the older age groups, and it's quite common over there. Then we'll be discussing the different sorts of classifications. So ranging from the morphological classifications, which are basically, it can be the nuclear, the cortical, and then we have the subcapsular cataracts on the other hand. And while we have the causative classification as well, depending upon the causative factors, which basically makes the foundation for the development of cataract in a particular patient. In the third and the final section, we'll be discussing the maturity of the cataract. So depending upon the maturity, there is another classification, and we'll be discussing that over here in the very third section. First of all, we'll be defining a mature cataract. So what are the particular or the salient features for a mature cataract? We'll be discussing them over here. Secondly, we'll be discussing the immature cataract. So we'll be basically comparing the mature with the immature cataract. What are the clinical findings that basically differentiate a mature from an immature cataract? And on the other hand, we have the other types depending upon the maturity, which are basically the hypermature cataract, and we have the Morganian cataracts. So that is what we'll be discussing over here. I hope you want to learn more about cataracts, so do watch the other sections to this lecture as well.